Thank you everyone for coming. I would like to just have you reference a couple of documents in addition to the agenda from your guest yesterday. This is the Senate web report, which kind of tracks through the appropriations, and then this document here, which is a total of 4 pages, 2 pages back to back. Which is an attempt to really take over a bill of over 100 pages and distill to you what we think are the highlights of the budget that has been voted out by the Senate Appropriations Committee. As we approach the budget, I think they were, as I said before, last year, sometimes we look at a budget in it. And so one of the things, obviously, that we've had a lot of discussion and felt was a priority, and that is looking at how well we were funding core functions of government. And this got into certainly the justice related sections. And we know, for example, our courts have a tremendous backlog, therefore people are not getting access to justice, but it's also where we realize the impact it was having even with children who are languishing in foster care because parental rights, hearings to terminate parental rights and release children for adoption were not happening in a timely fashion. So the impacts of how well we were funding those systems was really very strong on our minds. In addition, we also looked at what we were doing for our community-based organizations. And for those of you a little past history, we had a number of decades ago, large institutions providing services to people suffering from mental illness or intellectual and developmental disabilities. In that case, it was Brandon, one was Waterbury. And so we had a budget that actually had level funding for those organizations that provide really important services to our most vulnerable Vermonters. And so what we wanted to do is make sure that we were providing at least some increase because those agencies are really dealing with the same workforce demands or challenges as state government. And also, unlike the governor's proposed budget, recognizing the cost of the payroll that we put in for childcare. Not only were they level funded, but that payroll tax was going in July. And so you will find that in the Cliff Notes here that we are providing a 3% increase to those community-based providers. Now, that was a tough decision to get the money for that. And in addition, we were looking at that payroll, but also workforce demands relative to the contract. And this budget does include about $30 million for Pay Act for state employees. So the contract that the governor's staff negotiated for state employees is going to be over a 6% increase. So when you look at 3% for community-based organizations competing for that same workforce, we felt it was really imperative that we do something other than level fund. So that also was a priority. So those got into the programs that serve our seniors, people with disabilities, our youth service bureaus, and the list goes on. So I just wanted to point that out as one of the areas that we felt really needed to be shored up. How well are we doing? How well are we fulfilling existing commitments? Within the justice-related section, we did do a significant increase. We are increasing the number of judges, but also staff. Some of that staff is limited service, trying to get that backlog cleaned up. And then once that's done, that bulge of work would go away. So on this Cliff Note here, you will see that we are meeting our requirement for pension obligations, and those are very significant between, and I just want to remind people that the underfunding for both, but for the state employees, but also the underfunding of the teachers' pension is all on the general fund.
So those payments to get caught up for the years of underfunding and the amortized liability is all general fund. In addition, the OPEB, which is the healthcare cost for retired teachers, is also being picked up by the general fund. So those are very significant areas of spending, and I don't have the total off the top of my head, but they're probably 400, 500 million, somewhere in that vicinity. So it means that a very significant amount of the budget is really devoted to fulfilling current obligations or contractual obligations. One of the things that we had to do, because we wanted to address some of these areas of underfunding, and particularly in key areas, we had to raise some more revenue. And you probably recollect from my amendment to the miscellaneous tax bill that those fees are now in this budget. And so the fees and the additional revenue that was raised through the streaming tax that we passed a few weeks ago is assumed in building this budget. This is very similar, exactly the same thing as we did last year with the DMV fees. So you go down through, and I'm not going to read them all to you, but I think you can see how we've tried to really address key areas in terms of where we're funding base appropriations. Now, we were very cautious about what I call camel's nose in the tent kind of budgeting. And that is, oh, let's start a program up and let's only, so that we only have to pick up the cost for half a year. But then the next year you're building a great obligation. And so if you're going to fund something, and we did that certainly with the courts and with the state's attorneys and the Defender General, and that is to say, we're going to fund for a full year. We're going to recognize those costs, because the more you lowball them and they make it easy for maybe the current fiscal year, you're creating a tremendous pressure, funding pressure on the following fiscal year. So you'll see that we are creating the positions, but we're also funding them in that way. The other area that I'd like to just point out, and that is, as has been our practice, we have stripped out appropriations from the bills that came out of committees. And the reason for doing it is that way we can look at all those competing funding needs and requests together. And that is the unenviable job of your transportation, I was just in transportation, of your appropriations committee. And that is, it's the one place where all the work from various committees come together, because when you're working on a bill, like in transportation, that's really what you're looking at, but you're not seeing everything in totality. And so that's the challenge that we had. So we try to work extra hard, and you will see, for example, the positions and the one-time funding associated with 213, which was really looking to how we can mitigate against flood damage, and how we can fund a revolving loan, a dam loan fund. Also, we had another big bill related to emergency management and disaster recovery and mitigation, and that was S310. And so we have a lot of the funding, not to the extent that the committee would obviously like, but wanted to make sure that the towns that were impacted by floods that just happened to be after July, maybe even as much as 4 days later, had the same financial relief as we provided to the July designated towns. There are positions associated with getting a more robust emergency management system. And you will hopefully see where those bills have come in. In education, there was a position request for a CTE coordinator. That position was added, as well as the literacy position, which we know is a very compelling need. If in fact, I think it was about half our children are not reading at grade level. And so we really need to look at how we can look at our curriculum and how we can move ourselves up and have better reading competency. We did kind of organize where we were putting money into housing, into public health, into justice investment, and on workforce. And so there's a lot of different areas, and I'm not going to read them to you because it's all here. Really, this is extracting the appropriations, including the base appropriations and one-time. And that's the other thing we wanted to be very cautious about, although I will tell you, you'll see the governor was proposing to use the $12 million, we call it the plus payment, for the pension underfunding, was using one-time money to do that. This was dealt with through a reversion and making it very clear that that was being appropriated. And there's language here that that plus payment was part of what we negotiated when we did that pension reform and put ourselves on a path. And the only thing I can say is if you have long-term plans to be here in 2038, you're going to have lots of money because those pension obligations to get that underfunding taken care of will be completed by 2038. And as you can see, it will be several hundreds of millions of dollars that would be available to support other activities of government. Now, the budget is broken out into different sections. So the B section is where all the appropriations are by function. The C section is really where we're amending current fiscal year. And there's some things in here. For example, our public transit agencies provide non-emergency medical transportation to our Medicaid beneficiaries. And the methodology has not adequately provided the funding to underwrite the cost. And our public transit agencies operate on a shoestring to begin with, so their ability to subsidize that particular transportation service is negligible. And so what we have dealt with is the need to shore up that funding for both 24 and for 25. Hopefully they can get a new methodology, but when you're taking someone to a methadone clinic every single day, or you're having a number of patients having to be transported to Boston for specialized care, there's tremendous cost, and the methodology just wasn't keeping pace. The other area that we looked at is obviously in healthcare, and there's a part of our healthcare delivery system that is in very fragile state, and that is our nursing home, long-term care providers. And so there is the statutory increase in rates, but also history has borne out that recruitment with geriatric care and geriatric nursing is very difficult. And so as we've done with some other areas, there are some hiring incentives. With the workforce, we've really focused on a lot of the health-related professionals, but we do have a program that, and you will see for the first time, we're trying to put into the base at least a small amount. And it really is something that got started out with the Youth Conservation Corps, but now is a consortium of Audubon, Vermont Works for Women, and Youth Conservation. And it's really a great program to give work experience and skills to Vermonters who are more on the margins of our workforce, and yet our workforce needs are so significant. We need to make sure everyone can get into the labor market. And so that's called Serve, Learn, and Earn. And they're doing projects like in our state parks or painting barns and so forth, so that there is a service element that's also embedded in that program design. I don't know what else to go on. Obviously, housing is an important part. There's money in another housing bill, but we do have funding here for our VHIP program, healthy homes, manufactured homes. And then something that we're really we want to focus on, and that is what we call our ARPA sweep, and that's the federal money that has to be obligated, or we don't want to return any money to the federal government. So there's language in there, but we won't know what's available until September. So there's language around that ARPA sweep, and the first $40 million, as you can see, is going for FEMA match or to municipalities for hazard mitigation. And in S310, there was a special fund created. So if there's funding that's freed up and available through that sweep, then, and that is not needed for the FEMA match, would go into that trust fund. In addition, to confuse your lives, we have one-times that are in the money, and then the other is what we call one-time contingent. And we know that if you're watching revenues, and most people in this room are, our revenues for this year are running about 35 million ahead of projections. And so the other body anticipated that, and the first 20 million has been allocated for temporary housing. In addition, the next 3.5 million is allocated, and we agreed with this, to go toward homes that are at risk of flooding, but could be elevated and therefore could remain in use and on the property tax rolls. So that money would also go into that fund created in 310. And then we've added some other funding requests for the contingency, and you will see that on, well, the ARPA reallocation, and then some one-time expenditures. So I will simply say that we hope that we can have that ability to fund those contingent appropriations. It looks very optimistic that we will be able to do so. And I do have a sheet here, but and I'm not going to attempt to do it all from memory. The other area that was a lot of concern, and it's something that we've struggled with for years, and that's the emergency housing program that got established as a response to the pandemic. And it was put in place to prevent the spread of COVID. We have passed numerous bills. We passed a bill last spring relative to what we call the June cohort, and those are families that are still, or households that are still, many of them are single individuals that are still in hotels or motels. We have liberalized the GA eligibility for emergency housing. The standard rules have been 28 days for vulnerable, and then certain categories could get 84 days if they were catastrophic, and that would be like domestic violence or your house burned or whatever. So we're moving that to 80 days. So rather than having a category for catastrophic with just a 4-day difference, everybody 80 days. I would caution, though, that our goal is not to make the maximum or the minimum the maximum or whatever, because one of the things that we heard is that we put millions of dollars out to organizations that provide case management services. And we're hearing of individuals that have very significant health issues and disability. And some of the case managers apparently do not feel finding housing and working with that person is part of their case management responsibility. And our view is, yes, absolutely, that should be part of the responsibility. And if somebody's been in a wheelchair and has significant health issues and has been in temporary housing for 2 or 3 years, it indicates that we really need to make sure that all our resources that we are funding to serve vulnerable populations are being brought to bear to help these households. So we have liberalized the 28 days to 80. We have money in here for more emergency housing. In addition, the governor had recommended, and we did as well, 16.5 one-time money to go also to help us during this period of time. And the Health and Welfare Committee had worked on language around a task force to look at it, and so that language is included as well. So there's a lot of crosswalking between a variety of bills, trying to make sure that we were setting the right priorities. I will say that people would say, well, do you have this here? Or I really would like this. The request for funding exceeded what we had by hundreds of millions of dollars. And we some people would think if I argue or expand my justification, that'll make the difference. It really, for us, it was looking at all the competing needs, trying to prioritize them, look at what were those core services and benefits that should be provided by government and how we would make it work. So that is sort of the framework in which your appropriations committee approached this year's budget. This means that some people are going to say we didn't get everything we wanted. Some people are going to say, well, I didn't get much of what I wanted. I hope that if you look through, I think we tried to make sure that we were thinking about the wide range of needs and interests that have come from the various policy committees and provided the funding to support those initiatives. So I think with that, I don't need to go through this. This is really, I call it your Cliff Notes, but it really is extracting. And if you want to go through on the web report, you can track it through what the governor recommended, what the House did, and then what we did. And the other thing that we did, and you may have heard, that we have one of our prevention strategies has been the creation of community coalitions. And in the cannabis bill and the excise tax, a third of the excise tax, up to a maximum of 10 million, would be supporting prevention activities. And so the estimated revenue was 10 million for this year. So 3 million was allocated in the governor's budget to support the work of the coalitions. The House took out 1.5 million of that base money and substituted opioid settlement one-time money. And we did move it back. We said we've made a commitment. Those are ongoing expenditures. We don't want to take base money away from an ongoing need and use it to expand a base expenditure for something else. So you may have had some conversations, or you may have had people contact you about the funding for community coalitions, and we did make that correction. In addition, we have something in our ed fund, or within our education system, called Flexible Pathways. Early college is part of it, but there are a number of activities. And that was reduced by $1 million to go toward another initiative that's in the miscellaneous education bill. That Flexible Pathways funding is an entitlement, and just to take $1 million out that you will need to support the desire of the students in that pathways was restored. And it can be, if the desire is to appropriate $1 million for community schools, and that is the bill that's coming out of education, then we will look at that separately. So I'm going to open it up. And if people have got any questions, or maybe something that I haven't addressed that is on your mind, I'm more than happy to do so now. Did anybody have time to eat? No? Okay.
Well, and that is a thing. So if there are no questions now, or we can have 15 minutes for senators to go grab something to eat.
And you could eat and read this as well.
Not that you won't have a chance to ask questions on the floor, you will. Just wondering if there are no pressing questions now, why don't we adjourn this and come back at 1, or as close to 1 as we can get, and then we'll start, because it may be a longer floor session, so eating always good.
Oh, I would say there was one major initiative, and that is to make progress, or the first step, on dealing with the Medicare cliff. And that is very significant. It's been out there. It's been a concern. And so you'll notice that we have some language in there, and we're setting it at a level of 4.7 million general fund, so that we will make significant progress in dealing. And if you want to get into who's a Quimby and who's a Slimby and who's a cutie, then I'll refer you to Stephanie Barrett. How's that? No, so that was one initiative to address really the economic hardship that lower income households experience when they turn 65 and go from what they've been getting either through the exchange and the subsidies to Medicare. So it's called the Medicare cliff. And so I just wanted to point that out. It's something that people have been very interested in doing and making some progress. And so that was a priority for us as well. So I just wanted to bring that up. Thank you.
Thank you, Jane. So feel free to go grab some food, and then we'll be back at 13.